Hey guys, what's going on? Happy Friday, TGIF. Hope you guys are doing well. I just want to jump on to talk to you a few minutes about what we covered today in my live session. I know it's the end of the week, so welcome everybody who jumps on. Smiley face, here you go. Ask questions if you have any. And as you know, that when you're dealing with studying for any kind of exam, guys, the weekend's coming up. It's the fear of missing out. Trust me, I've been doing this for 10 plus years. So I know that everyone wants to relax and take it easy, but the more you plan, the more you execute, the more you apply your energy the right way, guess what? You'll be able to do very, very well, right? So that being said, uh, typically when you're studying for an exam like USMLE, you got to be committed full time. And I just wanted to show you a few key points. When you're studying, ideally, right, you're preparing for an exam, whether it's USMLE step 1, step 2, whether it's COMLEX for DO school, whether it's PA school, whether it's NBMEs, shelf school, shelf exams. You need to push forward. You need to be motivated, inspired. You need to be driven. You need to have that motivation within. That's what I give my students, even though my motivation expires. I'm motivated every day because I do a lot with me and my team, USMLE trainings. We work with step 1, step 2, step 3. Many students are struggling with NBME, school comps. We handle that as well. So when I jump on live like this, I want to share always a little bit of knowledge to get you perhaps over that hump that you might have, because it's a Friday. And I know that we all want to relax and take it easy. However, many people have to keep pushing. So if your exam is coming up respectfully in less than 60 days, I would be grinding every day, but that's me, right? So that's why ideally 6 days a week. Many students always ask me how much you have to study. 6 days a week, guys. Get it done, get over with, move on. This exam is one of many exams. It's not your life, it's part of your future, right? So this exam is important. Just like if I gave you an opportunity to work with me or work in the hospitals, you'd wake up and go to work, right? Many students are reaching out to us for internships, externships, sub-Is with our elite medical rotation service. So if we gave you, or if you signed up for a rotation, would you attend? Yes. So if you register for step 1, you have to wake up and study every day. That's where I come in and help you guys, right? So a couple of things. I wanted to bring up today pulmonology, respiratory, same thing. It's part of my 3-set process: CPR, cardio, pulm, and renal, right? They have the same physiology, like many things in medicine: preload, afterload in heart, lungs, same thing. And then the renal is afferent and efferent, right? So when I talk about points, whether you're watching this now, watching it later on recording, or sharing it with your friends, please share this to all your friends and colleagues that are studying for STEP. You have to change your mindset. You have to focus more on points. Points equals passing. Do not for once feel or think or assume that you're going to take all the basic sciences and cram it in a couple of months. You're delusional if you think that. If you need the backup plan and you need to reinforce information, 100%. But I'm telling you, because I care for you all, you have to know points. Quick example. Many of you here on medicine, so if you are, you could chime in at any time. You could put your information here by the smiley face that I have right there. If I asked you about respiratory and I said in the pulmonology system, we have certain diseases, right? We have restrictive and obstructive lung diseases. Yeah, there's certain ratios to that, right? Sure. And if I told you a patient comes in and they have a dry cough versus wet cough, you should be able to differentiate. Well, yeah, dry cough is a list of differentials. Wet cough has its own list of differentials. If I told you the person had cough with sputum, right, and it smelled bad, smelled nasty, foul smelling, malodorous phlegm, you would think anaerobic infection, right? Usually anaerobic infection, aspiration, pneumo. If I told you hemoptysis and the person coughs up blood, maybe you're thinking TB. I don't know. So this is what you have to think, and this is what we teach in our live sessions twice a week, and this is what we specifically target when we keep in mind how we're improving and increasing our QBank video library because it's on demand. So whether you are here, East Coast, West Coast in America, overseas, Middle East, South Africa, South America, and beyond, you can tap into our 24/7 on-demand videos, which will help you put together content and test taking. Most of you are here. Many of you purchase QBanks, Amboss, UWorld, Bootcamp, Kaplan, and there's a struggle with both. You read too much, you watch many videos, you know it, and then you answer questions, you get them wrong. And this is where I come in. This is where my team comes in. This is where our product comes in, right? So showing you this and talking about this for a few moments helps you realize, wow, I buy First Aid, I buy QBank, maybe UWorld, I read Pathoma, and I'm still at 50%. Right? So text QBank, the word QBank or QBanks, and my team will send you information so you could jump on to join us next week, because obviously we have sessions twice a week, every Tuesday and Thursday mornings. And then you'll see me live, attack questions. You could jump on and work with me live directly, and pick my brain and answer and ask questions that I can answer for you. But going back to respiratory now, I want to show you something briefly because I love Amboss. Amboss to me is the best possible QBank just because it has lots to offer. So this is why I use it with my students, right? Give me a moment. Let me just share my screen a second. Let me just pull this up un momento. Por favor. I teach my students Greek, Spanish. I teach them everything. When they work with me, you learn a lot. I promise you. All right. Check this out. I'm going to bring the screen on board a second. You guys can watch this. Let's see. Hold on 1 second. I tried to share screen. Give me a second, guys. Uno momento. 1 second, guys. All right, it is. It was a setup difference. My team, I had it set up differently for a previous session. Hold on. It's coming up. All right, here we go. Sorry. Technology is our friend. Okay, so check this out, right? Again, if you are studying for the boards, listen up. And if you're not, but if you know somebody who's studying for step 1, step 2, COMLEX, PA, anything, shelf, send them these videos, send them this link to this recording. It will help them, right? Check this question out. We have a scenario. Now, if you're part of my team, part of my system, you'll know that you read the last 3 lines, 2 to 3 lines. So I've had highlighted for you guys to look. The last 2, let's say the last 2 lines. Auscultation, the lungs show decreased breath sounds bilaterally. Okay, all right. So, I mean, they're not breathing bilaterally, decreased. Spirometry shows FVC of 78%, and the ratio is 95%. Ding, 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 stop. Immediately you see this, you think of what? It's only 2, restrictive or obstructive. It has to be restrictive. Anything of 80% or more restrictive, 80% or less obstructive. Again, make life easy. I make it easy for you in my QBank videos and my live sessions. So immediately you say to yourself, all right, if this is 95, that's over 80, has to be restrictive. Okay, look at the answer choices. Why would you read the rest of the case? It makes no sense. It literally, you save time if you just do this approach. But if you read, either A, you don't know the answer, B, you just want to waste time and fail the test. So look at the answer choices. Bronchiectasis, obstructive. Pulmonary artery hypertension, also known as PAH, does nothing with spirometry, out. Doesn't affect the spirometric values. Chronic bronchitis emphysema, that's COPD. COPD is obstructive, out. See how elimination is beautiful? I show you how to strengthen your power of elimination. Asthma, it's obstructive, out. Now we're down to 2. Pulmonary embolism, pulmonary fibrosis. Listen up. Typically at this point, this moment here, 2 answer choices is what has given headaches, strokes, anxiety, panic attack, TIAs to all medical students and physicians for the past 15 years, because it's always down to 2. It's not accidental. This is what the test writers love to do. So if you're down to 2, you got to find the answer. Guys, fibrosis versus embolism. If I need restrictive lung disease, which is the answer? Fibrosis. Boom. 85%. Clearly, easy question, but things can get very difficult, right? So showing you this is what I do live in my sessions, and I have students jump on, we do questions together, we participate, answer all their questions. And for those of them that cannot participate because they're working, obviously they're working part-time, full-time, they're all over the world, time zone difference, we record our sessions and archive them for them to access on the online community. But this is exactly what we focus on our QBank video library. Seeing something like this should automatically make you think restrictive. You go down the list and you have to pick the restrictive. There's only one answer choice. The problem, the majority of you don't know what these answers are. The majority of you who are studying are familiar with this information. You know what these answers are to a point. You're familiar with these terms. The problem is you don't know which one is which. And this happens in every organ system, heart, lungs, kidney, neuro, you name it. Every organ system has this problem. You have a list of nephritic and nephrotics for kidney, which we did yesterday with my team, with my students. And you know nephritic, you know nephrotic, but when I give you a list of 20, you're like, I don't know which one's which. That's why the majority of you have difficulty passing step one, because you're focusing on content. You're not focusing on the details or leveraging medicine to your advantage, to our advantage. And this is what we do. And this is what I wanted to show you guys specifically, because many of you ask, what do you do? Well, there's samples online. We have our YouTube channel. We have our website, USMLEtrainings.com. Everything is posted. It's basically how bad do you want it? How dedicated you are to pass. And if you want somebody to, if you want to be accountable. A lot of you are nervous and scared. You know, you search the websites and you ask questions for the past 8-9 months to my social media team, messaging me all throughout the year. And then I see these messages a year later and you're still struggling. It sucks because you don't need a full year. I tell my students, if you give me 3 months, dedicated 6 days a week, I don't see why you couldn't pass. But I know a lot of times people are struggling with work and everything else, right? So that's why I wanted to show you a little taste and also give you a little boost for the weekend, because the weekend's coming up and it's hard to stay focused and structured if you don't have a team by your side. So let me answer a question or two, whatever I got here, because I have everything. How are you? I'm doing well. I'm doing amazing. How are you? Hello, doctor. I want to start step one study. However, I'm thinking about only solving world questions. What do you think? Okay, you can try that and see how far it goes. You have to remember one thing. You can answer your world questions. Kalimera, Dr. Fortini. You could answer questions and see how you do. Basically, you're going to see patients. Answering questions at any QBank is the same as saying I'm going to see patients. Okay. Go see patients, see how you do. If you're happy with your score, continue. If you're not happy with your score, clearly you have to assess yourself. Many students who are not happy with their scores, the reason why, I don't know the content. I'm not familiar with the diagnoses. I know the diagnoses, but I don't know how to answer the question. I know what the answer is, but I run out of time. There's many different factors. So many students, they do questions, thousands, and they do well. Majority of students have to relearn the information, review the content, and help recall the info while they answer questions. So I want to hear from you, doctor. I think it's very doable. It just depends upon your basic science foundation. A lot of students are, they have to understand to go and start doing questions, you have to have a decent basic science foundation. So another question's coming in now. How do I know if I have a basic science foundation that's decent? You want to hear the little tip? All right, listen up and share this link to everyone that you know, because I'm spreading the message to everybody possibly in the world. I want you guys, whether you work with me or not, you can text QBank, you jump on board, we start working next week. If you don't, at least you get something out of this, right? Or share with someone that you know that will profit from this or help from this. When you are trying to assess yourself, right? Do something simple. Open up your QBank, Amboss, UWorld, Kaplan, boot camp, whatever, right? There's so many. Every now there's this, it's nonsense. There's so many, but there's only 2 in my book, right? UWorld, Amboss, top 2. Open up your QBank and create 3 blocks of 40 timed. That's it. 3 blocks of sets, 3 sets of 40 questions timed, and do them and see how you score. Clearly, you want to score over 60, 65%, right? Doing that saves you on NBMEs. Don't waste them. NBMEs, you don't want to waste NBMEs on getting your baseline, because you don't want to use them all up. Plus, you have to pay for them. Do it later in your prep. Open up your QBank, 3 blocks of 40 questions timed. Assess yourself. Figure out, why am I getting it wrong? Am I getting questions wrong because of content? I got to go back and learn more. I'm getting questions wrong, not so much of content, but because I'm second guessing, overthinking, changing right to wrong, all the list of test taking problems and skills I always present to you all. Then you have to do more questions. So curious to hear how it goes, Doc. Reach out to me, send me a message. You can send me a message on any social media platform. We're going live now on Facebook, LinkedIn, YouTube, Instagram, and I'm always here to help you guys out. Text QBank, QBanks, USMLE, 3 different words will get you to the same result, working with me directly and joining my team of students weekly to conquer USMLE. No gatekeeping the secret sauce here. Exactly. I mean, listen, I want you guys to do very well, just like anything else in life. This is an exam. You have to navigate precisely and efficiently to do very well. I know many of you are struggling out there because you guys constantly contact my company, which I love to hear from you. Many of you join, many of you don't. It's up to you. But when I hear doctors studying 6 months, 8 months, 1 year, putting up, sacrificing family, friends, time, and money, because every year that goes by is a year wasted from getting into residency. So residency in America, you make between $50,000 and $80,000 a year. So every year that goes by, you're wasting close to $70,000. And then 1 year closer to becoming an attending, which is roughly at least $200,000 minimum. So if you want to put the numbers in, those are numbers live and the tough love to get your ass in gear. Because if you want to pass this test, it needs to be full-time dedication. And if you dedicate part-time, you'll get part-time results. It'll take you longer to take the test. Very simple. It just makes sense, right? Okay, doctor, thank you. Can you tell me what to register with you, please? What course? Well, there's only one course we're talking about now. It's step 1. I do step 2, but step 2 is private one-on-one. You can contact USMLEtrainings.com or just type in the word QBank and you'll get the link sent to you. It'll be directed. You'll be sent to my website, and you could jump on and start working with us. As soon as you register, you'll get access to all my course material. You get access to all the video resources, the QBank video library, my 3-month study plan, and a link will be sent to you via email to jump on board and work with me live every Tuesday and Thursday. All right. Dr. Potini, you're awesome. Thank you. Doctor, guys, I thank you all. Jump on board. I'll see you next week. Get to my website. And then next thing you know, starting next week, we're hitting 2 more organ systems. You become a part of a family. And many of you need study partners. And I have study partners in the community because, again, we're building the community day by day. We have over 1,200 students in our online community. And we're looking forward to keep growing it week by week. All right. So have a wonderful weekend. Text QBank, and you could start jumping on with us immediately. Share this video to everyone you know, schools, students, because I need you guys to use first aid the right way and a QBank the right way. Stop putting and wasting over a year of your life for step. Okay. Give me 3 months and I'll get you to pass. All right. Thank you, guys. Have a wonderful weekend. Stay safe. Study hard. Be selfish. Take time for yourself, right? You need to relax here and here a little bit. And then I'll see all my students back on next week when we hit more organ systems every Tuesday, Thursday morning at 8 a.m. Central. All right, guys. Have a wonderful weekend. All the best. Ciao.